My name is Shannon Simmons. I am a student of Professor Wetzler's Health Assessment 1 class on Wednesday. This is my week 7 assessment of the head, neck, and chest. This is Mr. Bear. He's my patient. We give you permission to view this video, and I'm going to go ahead and get started. Oh, my D number is D410964997. Hand hygiene as I walk in the room and I shut the door for privacy. Hi, Mr. Smith, how are you today? Good, that's good to hear. My name is Shannon. I am a student nurse. I am part of your care coordination team. I'm here to make sure everything goes smoothly for your visit. Today my job is going to be to do a head, neck, and chest assessment on you. What that means is I'm going to be looking, I'm going to be feeling, and I'm going to be listening to your head, neck, and chest. Listen to your lung sounds, some heart sounds, things like that. It should take about 20 minutes. Is that okay? Okay, thank you so much for your cooperation. I appreciate it. So before we actually get started with the assessment, I do need to ask you a couple questions. Can you confirm your name and date of birth for me? Bear Smith, 11/12/97. Okay, all right. And do you have any allergies to any medications or food? No. Okay. And I need to ask if you're I need to assess if you're in any pain. So on a scale from 0 to 10, 0 being no pain at all, 10 being the worst pain ever, what number would you give yourself? A 0. Okay, good. All right, we can go ahead and get started with the general survey portion of the assessment. What I'm going to need to do is, before we get started, we're going to have to take off your shirt so I can assess everything appropriately and listen to things when I need to. So the general survey part is I'm really just getting a basic comprehension of your overall health, okay? So I need to assess your orientation. Can you tell me where you're at? We are in my parents' basement, correct. And do you know what day it is? It is Thursday. And who's the president? That's correct. Okay, so the patient shows no signs of acute distress. The patient is oriented to person, place, time, and situation. The patient's behavior, facial features, patient's behavior, facial expressions, mood, and affect are appropriate to situation, and the patient's speech is clear. All right, Mr. Smith, we're going to assess your skin and nails next. So basically, I'm just going to look at the skin on your head and neck and your arms, and look at your nails, look for any abnormalities, those types of things, okay? All right, looking for the skin, the color, your arm, just doing that. All right, looking for your nails, looking for the color, no signs of pubbing on either side. Okay, I'm going to assess your capillary refill. Less than 2 seconds. And less than 2 seconds. Less than 2 seconds on both sides. Okay, so the patient's skin color is appropriate for his bear race. He has no signs of wounds, lesions, or incisions or piercings. The nails are pink, no signs of clubbing. His capillary refill is less than 2 seconds bilaterally, and the patient's temperature is warm and dry on both sides. Moving on to the head, neck, and face, we're going to be doing an inspection, just looking for any lesions, deformities, masses, infestations, specifically in the hair. And looking at your face for symmetry, sorry. So looking for your facial symmetry. All right, so there are no lesions on his head, neck, and face. There is no sign of infestation, thankfully. His facial features are symmetrical, and there are no obvious deformities. All right, Mr. Smith, we're going to move on to your eyes. What I'm going to do is I'm going to inspect the external features of your eyes, so your eyebrows, your eyelids, your eyelashes. I'm looking for any redness, I'm looking for any drainage or discharge, and then I'm going to look at your pupils, if I can figure out which pocket my pen light's in. So I don't want you to look directly in the light. I want you to look at my nose. I'm going to cover this eye. I'm looking at your pupillary response bilaterally. All right, looks good. And if you can follow my pen, just look at the top of the pen. I'm going to move the pen out and I'm going to move it back in. I don't want you to move your head, just your eyes. Okay, moving it up, moving back in. All right, good job. Now I'm going to look at the conjunctiva of your eyes in the sclera. I'm going to pull the lower eyelid down on each side. Okay, all right, thank you very much. All right, so the patient's external ocular structures show no sign of redness or discharge. His conjunctiva is pink. His sclera is white. His pupils are 4 millimeters bilaterally. I don't know what I just said. Pupils are 4 millimeters on either side. They're equal, round, reactive to light, and show accommodation. Pardon me. Moving on to your ears. Ears are pretty easy. We're just going to look at the outside of your ears, the external auditory meatus. I'm looking for any discharge. I'm really looking for any redness, swelling, making sure there's nothing wrong with your ears. Looking on both sides. All right, they both look pretty good. Patient's auditory external meatus shows no signs of discharge. And based on the conversation, his responses back to me, his hearing seems to be intact. All right, Mr. Smith, we're moving on to your nose. I'm first going to look at the external features, make sure everything is symmetrical, you don't have any deformities, lesions, masses, things like that. And then I'm going to look at the internal parts of your nares, and I'm looking for deformities, I'm looking for symmetry, and I'm looking for any inflammation. Okay, so I'm just going to pick up or push up the nose, look in both nares. My pen light only works sometimes. Sorry. Looking in the nares. Oh, look, there it goes. Another nair. All right, so the next thing I'm going to do is I'm going to have to push one nair down and ask you to breathe through your other one. I'm just kind of making sure that both are patent, okay? So we're going to push the left one down, breathe through your right nose. Okay, pushing the right one down, breathe through your left nose. Okay, thank you so much. I know that one's weird. All right, so the patient's nose shows no signs of deformities, no signs of deformity or asymmetry, no inflammation of the internal structures, and the nares are both patent bilaterally, and there's no drainage noted. All right, Mr. Smith, we are moving on to your mouth, which is pretty easy. All I need you to do is open up and say, ah, stick your tongue out a little bit for me. All right, I'm assessing Mr. Smith's mouth, or his lips, his tongue, and his gums. For color and moisture, they are all pink and moist. So that would be lips, tongues, and gum are pink and moist. Right? Tongue, no. All right, good. We're moving on to your respiratory system. This part's pretty fun. So what I'm going to do is I'm going to just look at the anterior portion of your chest. First, I want to make sure you're not using any accessory muscles to help you breathe. You're not having any problems breathing. And now I'm going to listen to your lung sounds. I'm going to do it on the anterior portion of your chest, and then I'm going to flip you over and do it on the posterior portion. So I'll walk you through, I'll tell you which lobe and side I'm listening to as I listen to them. So I always like to start at the right upper. So this is the right upper lobe, and I'm listening for, what I'm looking for is normal breath sounds. I don't want to hear any noises, I don't want to hear any abnormal findings. I'm looking for just clear, nice, easy breath sounds. This is the left upper lobe. The right upper lobe still moving right along that sternum. Want to assess on both sides of it. Left upper lobe again. I'm moving into the right middle lobe, and then the left lung does not have 3 lobes. It only has an upper and a lower. So this is still going to be the left upper lobe. Okay, moving right here underneath the breast tissue is going to be the right lower lobe, and then the left lower lobe, same position. All right, again, right lower, left lower, And the last time on the front, left, right lower, and then left lower. So when I listen to your chest, I'm trying to listen in a C pattern, I'm listening in a zigzag, I'm listening in a C pattern on your chest, and a zigzag repetitive motion, so I can compare the right to the left. I'm going to flip you around, listen to the posterior portion. I think you get heavier every time. No offense. For sure. Okay. All right. Same thing. We're going to start on the right upper lobe. Listening for the breath sounds. Go to the left upper lobe. Come back in that C formation. Right upper lobe still. And then the left upper lobe. Right along that vertebral spine. Still right upper lobe, right on the border of it. Left upper lobe. Moving into the right lower lobe, and then the left lower lobe, right lower lobe again, left lower lobe again, one more time, right lower lobe, and then the left lower lobe. All right, I'm going to flip you back around, Mr. Smith, I think. All right. There are no signs of accessory muscle usage on the patient's anterior chest. Patient's lung sounds are clear bilaterally in all fields on both the anterior and the posterior chest. All right, Mr. Smith, we're going to move on to the cardiovascular, which is my favorite part. With this one, I'm going to walk you through it. The first thing I'm going to do is I'm going to assess for your carotid artery sequentially, and then I'm going to listen to some heart sounds, and then I'm going to take your radial pulse. And when I listen to your lung sounds, I'm going to use the diaphragm portion, and then I'm going to do it again with the bell, just so I can hear what the different sounds sound like, okay? We're going to start with the carotid artery. Find your trachea midline. Move over to the left carotid. Feeling for the actual pulse, I'm feeling for the rate and the rhythm that's normal. Moving to the right, carotid pulse is present, and the rhythm, rate and rhythm. All right, the next thing we're going to do, this one's a little weird. We're going to have to assess for any jugular vein distension. So I apologize in advance. I'm going to have to tip you back to about 45 degrees in a supine position so I can assess for any jugular vein distension that happens, okay? I won't drop you. So we're going to lean you back to 45 degrees. I need you to turn your head. Can you still see me? Let's turn. Lean you back. Can you turn your head away from me? Okay. I'm assessing the jugular vein for any obvious distension and looking for any pulsating beats. I don't see any. All right, let's lean you back. Do it again on this side. Again, 45 degrees. Supine. This chair is not having it. It's not liking me right now. All right, looking for the jugular vein, checking for any distension, any obvious pulsations. I don't see any. All right. This part's my favorite part. We're going to listen to the different heart sounds, and I will explain what they are and where they are as I auscultate them with the diaphragm. All right, I think yes. All right, so the first one is called your aortic valve area. So what I'm doing, I'm just finding the valves in your heart, and I'm listening to the noises they're going to make. So the aortic valve area is in the second intercostal space, on the second intercostal space, right sternal border. So I'm going to find your clavicle, find the space underneath, that's your first intercostal space. Find 2, that's your second intercostal space, right on the right sternal border. It's your aortic valve area. I'm listening for S1 and S2. I hear both of them, and I don't hear any murmurs. Okay, we're moving on to the pulmonic valve area, which is on the opposite side. It's also on the second intercostal space, but it's on the left sternal border. So we're going to find your clavicle, count 1, S2, and this is your left sternal border. This is your pulmonic valve area. I'm listening. I hear S1, I hear S2, and I hear no murmurs. All right, the third point we're going to listen to is called Erb's point. It's the third intercostal space, and it's on the left sternal border. So we're going to count down 1, 2, 3. Left sternal border. This is Erb's point. I hear S1 and S2 equally. No murmurs. We're moving on to the tricuspid, which is in the fifth intercostal space on the left sternal border again. So we're going to 1, 2, 3, 4, 5. Pardon me. Again, left sternal border. Listening. I hear S1, I hear S2. No murmurs noted. All right, the last heart sounds that we're going to listen to are called the mitral valve area, and it is in the fifth intercostal space in the mid-clavicular line. So we're going to count down to the fifth intercostal space again. 1, 2, 3, 4, 5. Fifth intercostal space. Find your clavicle. Go halfway in between it. Find the mid-clavicular space, and then listen right at that spot. That's right where your apical pulse would be found. And I hear S1. I hear S2 with no murmurs noted. All right. Last thing I'm going to do is take your radial pulse on both sides. Radial pulse is present. Radial pulse is present. All right. Okay, so the patient's carotid pulse is present. 2+ pulsations bilaterally with a regular rate and rhythm. There's no JVD noted on either side at a 45-degree angle supine. I heard no murmurs over the valve areas, and both radial pulses are present. All right, Mr. Smith, that concludes my portion of the assessment. I want to make sure that I didn't cause you any pain. I know we had you moving around and leaning back and everything, so I want to reassess to make sure that I didn't cause any pain. So that scale from 0 to 10 again, 0 being none, 10 being the worst. Where's your number now? 0. I like 0 still. Okay, let's go ahead and put your shirt back on, make you a little bit more comfortable. Can I get you a glass of water or anything else? No? All right, so if the patient were in the hospital, I would make sure that the bed is in the lowest position, that the side rails are up, that the bed is locked, and he has access to his call light. Okay, all right, Mr. Smith, do you have any questions for me before I go? No? Okay, thank you so much for your time and patience. I really appreciate your cooperation today, and I would perform hand hygiene as I exit the room.